Connect. Well, good morning, everybody, and thank you so much for joining the Herts Chamber of Commerce in the next series of webinars. We've been running these for many months now, and we are really pleased to be able to bring you topics that are relevant of the moment and really participatory with your involvement in terms of Q&A. What I'd like to do is certainly, as I say, welcome you, but also mention a couple of things. The session today will be recorded. So when it gets to the Q&A section, if you either want to type in any of your questions into the chat or simply raise your hand at the end and then we can unmute you. I would ask you to mute yourselves for the presentations. Be grateful for that. Also to let you know that our speakers today are really happy to share some slides. Those will be emailed to you along with a link to the recording after our webinar concludes at 11:45 this morning. And I think really, without further ado, it's the opportunity for me to let you know that, of course, we're here to talk about employers' obligations and avoiding liability claims as office premises become open again and we find the new normal, and we are very cognizant of the government regulations that sometimes are changing, and you have to keep an eye on that. But we've got some experts here to speak to you. So we've got two speakers today who will be speaking for about 15 minutes each. We've got Kaajal Nathwani from Curwens Solicitors. She's a partner and the head of employment. We also have Peter Smits, who's the managing director of Ashbourne Insurance, and he's been working at Ashbourne for 20 years, and he will also be giving us some guidance on returning safely and reinstating our office premises equipment and so on in a very coherent way with some guidelines. So I think just because time is marching on, it will be the opportunity now to hand over to Kaajal. Good morning. Thank you for being with us. I would like to say that Kaajal also is a real specialist in all aspects of employment law, and I would encourage you, if you don't feel it's appropriate for you to ask really specific questions of your business and your industry, to feel free to get in touch with her directly afterwards. Her details will be shared, and we're also happy to provide those introductions for any bespoke questions that you've got. So Kaajal, thank you for being here. Over to you.
Thank you very much, Mary. Good morning, everyone. So lovely to see some familiar faces and also lots of new faces, and I look forward to getting to know you all at the end of the session in the Q&A part. So, as Mary said, thank you for the introduction. I'm a partner and I specialise in employment law at Curwens Solicitors, and I am going to share my screen shortly, so bear with me. I'm not tech savvy massively, but I'm hoping that I'm going to be able to do this. And there you go. Hope you've got your cups of teas ready. Aha, there you go, something's happened there. There we go. So what I'm going to go through this morning is what you need to do as an employer to minimise the potential risk of claims. Now, most of you will be aware that, you know, whilst COVID has brought up a whole host of issues with regards to ensuring adequate health and safety in the workplace, employers have always had an obligation to ensure an adequate and safe workplace for employees. They have a variety of statutory and common law duties with regards to health and safety. And my talk today is going to primarily focus on the enhanced responsibilities following government guidelines as a result of COVID, and to try and get everybody back to work as safely as possible. So the government has essentially set out a plan with regards to returning to the workplace so that we can get to as near as normal as possible as quickly, and to ensure the safeguarding livelihoods and ensure that the NHS isn't inundated with lots of virus cases. So they've set out some guidelines to stay alert and safe, which all of you will be aware of. And employers who have people in their offices or on site are advised to ensure that they basically follow the guidelines on working safely. I've set out some key dates here for you which may be of interest. I won't go through them from the very beginning of when lockdown started, but essentially on the 13th of May we had an announcement where if people couldn't work from home, then they were actively encouraged to return to work. Now that threw up a whole host of issues for employers, because the expectation was initially in the announcement that employees get in touch with their employers and then engage in a dialogue with regards to how, you know, the facilitation would take place in terms of them returning to work. And then we had all the guidelines issued for various industry sectors. So far, it's expected that on, you know, 4th of July is D-Day for restaurants, hospitality, places of personal care, so beauty salons, hairdressers, and there'll be a whole other spate of guidance that will be released in relation to that. But for the moment, we are focusing on the industry sectors that have already got the guidance available with regards to the steps that they need to be taking to ensure a safe workplace. So the concept is COVID secure. We need to make sure the workplace is COVID secure, and there's extensive guidance available on the HSE website, and I've put the link to the website there for ease. And it's also a great resource for employees who can check the guidance to make sure that their employer has adequately implemented the guidelines and put sufficient measures in place to ensure that the workplace is as safe as possible. And it's all about minimising the risk and the exposure to them of the virus and the spreading of the virus. So recommendations include obviously deep cleaning of offices. It's fairly, you know, common sense. Deep cleaning of offices, shops, workspaces, provision of PPE if appropriate, and that would obviously be dependent on the nature of the workplace and sometimes to do with whether or not, you know, social distancing can be maintained. There might be certain environments where it's absolutely not possible to ensure that somebody is a 2-meter distance away from another employee, and in which case there might be consideration to be had as to whether or not PPE is, you know, an appropriate measure to take. So for example, Boots, the high street retailer, has opened, and they actually ensure that all their staff are wearing visors, and you know, that's an appropriate measure to take, because if you can't ensure that people are going to be a 2-meter distance away from each other and adequately mitigate the risk of the virus and the exposure to potentially carriers of the virus, then you know, visors might be appropriate. And there are specific recommendations for certain sectors, as I've already mentioned. So by law, employers are required to protect employees from any harm. And under the management of the health and safety at work regulations, the minimum that employers need to do is identify what could cause injury or illness in the business. So identify the hazard, decide how likely it is that someone could be harmed as a result of that hazard, so identify the risk, take action to eliminate the hazard, or if that isn't possible, control the risk of that hazard. So assessing the risk is just one part of the overall process used to control and minimise the risk in the workplace. For most small, low-risk businesses, the steps, again, I keep repeating the HSE guidance because that is the Bible, essentially. So everybody needs to go to that to make sure that they are taking the adequate steps as set out in that guidance. So how do you do it in practice? It's all well and good that we've got a whole raft of guidance that's been published across 8 different industry sectors. But in terms of taking those practical steps, how is that done? So you can do it yourself, depending on the size and the administrative resources available in the business, or appoint a competent person to help you. Now, many organisations have an existing appointed health and safety officer or risk assessment officer. So that would be the most appropriate person that you would bring in to try and help to navigate through this minefield. I've just put a summary there of what you need to do. So the HSE guidance on a COVID-19 risk assessment, again, identify what work activities specifically in your organisation might cause transmission of the virus. And think specifically in your business, including employees and clients, contacts, customers who could be at risk. Decide how likely it is that someone could be exposed and act to remove the activity or situation. And again, if that isn't possible, try and control or minimise the risk. Something that's worth noting here is if you have fewer than 5 employees, you don't necessarily have to write down the findings of the risk assessment, but it's always best practice to do so and to keep a paper trail, because I'm looking at it from an employment lawyer's perspective that whether or not you've got 1, 2, 5 or 20 or 200 employees, if that employee brings a claim against you and you have to defend a potential claim in the employment tribunal for whistleblowing, it would always be great to have a paper trail to show that you took all the necessary steps to mitigate any risks and therefore counter any allegations that you failed in your obligations to maintain a safe workplace. So essentially, the government has set out 5 steps to working safely, and they are general guidelines across all industry sectors. And we've already discussed carrying out the COVID-19 risk assessment, but there's also a recommendation that organisations develop cleaning, hand washing and hygiene procedures. So there might be an additional consideration that you need to have here for installing hand sanitising workstations, making sure that you've got disposable towels to dry hands. So there's certain things that you need to be considering there if you don't already have those measures in place. Now, there's a firm in the city, and it's been highly publicised, that the extreme measure that they've taken as part of their overall risk assessment is to ensure that in communal toilets, that whoever's using, there's one person that goes into this communal space, but all doors are left open, and there's someone just at the main entry point guarding that door to make sure nobody else comes in. So that is minimising the number of people in that space and avoiding the touching of door handles and the issues that we have there. I mean, that is a massively extreme measure, and you've got to, it's a balancing act, because of course you want to make sure that your employees are comfortable with the measures that you're deciding to put into place. So the overarching thing is help people to work from home as well. And that's very important, because we go by the fact that if you can work from home, then that's still the preferred course of action. But if you're going to work, maintaining a 2-metre social distancing wherever possible. Now, there is a report that, the 2-metre social distancing may well be relaxed to 1 metre. It remains to be seen whether or not that is, again, industry or sector specific. It's likely that the 2-metre social distancing rule will be relaxed for certain sectors, such as hospitality or personal care, where it might not be it just might not be feasible to maintain a 2-metre social distancing, but then additional adequate measures might be necessary, such as PPE gear. So what you need to do as an employer is talk to workers and provide information. So this is the consultation process. Now, the theme throughout the whole of the pandemic has been maintain an open and fluid dialogue with your employees, whether it's addressing their concerns about returning to work, or whether it's to do with returning to work and having the relevant health and safety measures in place. So explain the changes that you are planning to help them all work safely. Put their mind at rest. Make sure changes will work and hear their ideas, because there might be something that they suggest that you hadn't previously thought of. It's a two-way process. And you need to give sufficient time prior to reopening to ensure that you consider any of their ideas and also fully explore all measures that you could be taking. Something that you need to note is that if you have more than 50 people returning, there is a requirement to publish your risk assessment on your website in order to ensure that you are complying with the regulations. And I'm sure Peter will address that in terms of the insurance perspective, to make sure that you don't invalidate any insurance policy because you failed to make sure that you've done these things. Something that's also become an issue is commuting and getting to work. What if employees have concerns about them actually being able to get to work safely, and it's not necessarily to do with the workplace itself? So the HSE has limited guidance on commuting to work. Employers need to identify where people can travel to work using their own transport, that they need to do this, and this should be actively encouraged and ensure social distancing is maintained. So there's little guidance about, the cost of bringing your own car to work and whether or not the employer needs to make a contribution to that. Again, all of these are massively grey areas, and we are seeing, everybody trying to navigate through this, and then questions being thrown up as a result. So for example, people working in the city, it might be appropriate for them to take their own car to work. Who pays a congestion charge? Who will pay for parking? We don't know the answers to any of this, and at the moment it's all about the employer and the employee navigating through this together. With regards to public transport, so buses, trains, employees are required to consider all other forms of transport before using public transport. So it may be that employers, in order to maintain an adequate and safe environment at work, not only for the employee who's having to use public transport, but for other employees, because of course if somebody uses public transport and they come to work, they are potentially exposing other individuals to any germs that they could have picked up whilst on their travels. To listen to potential alternatives. Could it be that actually, you know, they start earlier or come in later when the potential exposure to public transport is minimised, i.e. there are fewer people travelling, so it could be shift patterns that you look at. It could be potentially that you pay for their travelling in their own car, so various different things that you can consider there. So just to summarise, you know, I've mentioned before that employers have a myriad of health and safety obligations relevant to COVID-19 under the following legislative provisions. Now, those obligations have always been there, but they have also been sort of heightened and brought to the fore as a result of COVID-19. And there's this additional risk that you need to be mindful of. It's not, you know, isolated to those trailing wires or potentially, you know, exposed plug sockets, or, you know, making sure that your equipment is tested for electrical safety in the kitchen before someone wants to make their toast. It's a whole new ball game, so we need to make sure that we are on top of that. The main reason why we need to make sure that we are on top of that is because the law protects employees from detriment if they leave or feel that they have no option but to leave and tender a resignation because you failed in maintaining an adequate work environment that complies with health and safety regulations, and also protects them from any kind of dismissal or termination of employment as a result of them having raised complaints to you. So, you know, you really need to think very carefully before you take any action against employees who've made any kind of complaints or brought to your attention concerns that they have with regards to health and safety in the workplace. The test is that the employee must have a reason to believe that there is a danger that is serious, i.e. of COVID-19 in the workplace, and that you as an employer have not taken adequate measures to render the workplace safe. When it comes to vulnerable workers, I'm conscious of time here, so you know you might have to have further considerations for vulnerable workers returning, to put in additional measures to maintain a safe environment for vulnerable workers, perhaps consider whether they should be returning to work at all. Now, there's been lots of information in the media about ethnic minorities who are referred to as those of BAME backgrounds, of being you know, in a vulnerable category and a potentially high risk category. So that's also something that might require consideration, and that has a twofold employment angle. So you may have someone from an ethnic minority background who says, look, I'm not happy to return to work because I do fall into a higher risk category as identified following recent research, and actually, you know, it's not good enough for you to, as an employer, to turn around and say, well, I don't care, you need to come to work, because that requirement or provisional criteria of requiring that individual to come to work could be construed as placing that individual at a significant disadvantage due to their racial or ethnic background, and that could be construed as a discriminate act on your part. Pregnant workers as well, you need to make sure that you're taking adequate steps to ensure the workplace is safe for them to return if there's no other option but for them to return. And with regards to those who've been advised to shield, i.e. those who've received a letter from the NHS, please note they must remain at home. It is actually a breach of the law if you make those individuals return to work. Again, that throws up a whole host of other issues which I'm not going to deal with in today's talk, but they should remain working at home if possible, and if not, it's likely that they have been placed on furlough, or another option is for them to remain at home on statutory sick pay subject to eligibility criteria being satisfied. So in summary, HSE guidelines, that is your Bible. Please make sure that you check the HSE guidelines, as these are a moving feast and continually being updated, relevant to your industry sector, as well as the 5 generic steps that employers should be taking. Write it all down, keep a paper trail, emails, charts. There are risk assessment charts available on the HSE website that can be used, and that just makes this whole process a lot easier. So write it all down, because as long as you can demonstrate that you've taken the adequate steps, you have got evidence to mitigate any potential exposure that you may have to a potential claim. Okay, and that's me. But if you've got any other questions, then please ping them on the chat and I'll try and address them in the Q&A. Thank you.
Thank you very much to Kaajal. A lot of information to go through there. And I know we've already had one question come through on chat from Gary, but we'll leave that till the end, if we may, in the Q&A. I'm going to now hand over to Peter Smits, Managing Director of Ashbourne Insurance. Thank you very much.
Morning all. I hope everybody's keeping safe and well. And I guess from my perspective, really, a lot of this is just going to reinforce really what Kaajal was saying there. We are an independent broker and we've done a whole series of webinars and conferences with insurers who are concerned about the workplace and returning to work. What I've done is I've just tried to sort of break that down into some high-line questions really, and this is the sort of discussion we would be having with some of our clients so that they can preempt certain things and avoid any liability claims that may be thrown at them at a later date. Insurers are very, very concerned about the possible spike in employer liability claims as we return to the offices and the factories and the shops and what have you. Not because they think for one second that they'll be inundated with a load of, employees claiming they contracted coronavirus, because I think the likelihood of being able to prove that is pretty minimal. But actually, what are the implications for the member of staff by returning to a workplace? And has that workplace been prepared, for example, in line with guidance of social distancing and government advice? The best thing to do really is start with your existing risk assessments. That if it was right prior to the pandemic, there are elements of that are still going to be very right now, but then you should look to modify those and update them with this ever-changing risk. One of the things to think about is things that have been misplaced over the past sort of, 2 to 3 months, and think about how you're going to integrate that misplacing back into the environment. And that could include staff, it could include stock, materials, machinery, computers. And also consider the consequences of lockdown for implications for different levels of stock and machinery. You could have things that have been displaced over a period of time, which could cause other pressures or other implications. What are the implications for plant and machinery that has lain dormant for 3 months? As staff begin to start to use them again, what could be the consequences of a malfunction or failure at startup? That could result in an accident or an injury, and that needs to be managed. What is the process for testing plant and machinery for infection control? Effectively, and one insurer referred to this yesterday during a conference call, effectively you should create a new loss prevention standard, and it should be documented. The document should detail how you plan to implement this standard, how you would communicate it, but also how you would measure its success as well. We see a number of claims where someone says, have you got a process? And they say yes. And then they say, well, show us how you implemented it. So it's all well and good having something written down, but it's actually the workings of it. And I don't, a lot of this I'm talking about here, I don't think this is any different than standard health and safety and what Kaajal was talking about. This isn't doing something new, it's actually doing it right and implementing it. As Kaajal mentioned as well, I read a lot about PPE, and from what I can make out, particularly from an employer's point of view, is not necessarily just the issuing of PPE, but strangely, it's actually training the staff on how to use it. And is it relevant? There are some environments where it may not be recommended. Some advice I've read actually explains that if social distancing can be observed, then you should not issue PPE. The implications for its permanent use, in an incorrect environment, probably far outweigh the safety element. The other thing, and one of the important things as well, is just don't assume that statutory controls for your industry or your environment are to be relaxed. Far from it. Any changes that you impose on your work environment, whether those staff are working remotely in an office, a shop, a factory, whatever it may be, they should not compromise existing statutory controls or security. It's worth noting actually that in the event of theft, most insurers will only pay for what they call forcible and violent means of entry and exit. You may well have taken steps to wedge doors open to stop staff touching pinch points, but what are the impacts there for security then if all your doors are open? And also think about what has happened to your premises whilst they've been unoccupied. Has the integrity of the building or has there been any structural damage? Do you need to implement some form of maintenance program before you get people back into the office to ensure that their health and safety is observed? Simply set clear targets, revise site plans, review working practices, reduce interactions where you possibly can. Think of pinch points, printers, kitchens, all those sort of things, and anything that will reduce the possible risk of infection. And then actually returning to work itself. An insurer would expect you to consider key roles within your staffing, people like first aiders, fire marshals, key holders. What are the implications for them? Has their role changed? Do they need to do anything different? They talk about notifying your stakeholders before you return to work. And your stakeholders, just not necessarily limited to your staff, could be your landlord, customers, contractors, subcontractors, suppliers, even your neighbours. Anyone that is affected or could affect the premises is relevant in these risk assessments. I think most importantly on that, it's very, very important to communicate with the landlord, involve them in your plans, and ask them the same questions. Are the premises fit for purpose? If we think about shared office spaces and again, choke points throughout the buildings, what are the implications for your staff there? And again, as I mentioned just before, will any changes to your risk assessments or any plans that you want to introduce, will that impact on the integrity of security of premises? You need to think about security risks if doors are left open to try and reduce the chance of infection. And again, it shouldn't be at the risk of the normal statutory controls. Insurers talk a lot about pandemic legacy during recovery. Most of them are focused on 3 key areas that they believe will impact future business moving forward and potentially any insurances that you may have. Not just for avoidance of claims, but actually to get the best insurance that's fit for purpose. So the 3 key areas they're now talking about are digitalisation, supply chain, and healthcare awareness. Digitalisation, well, we're all sitting here today on a Zoom meeting, aren't we? Back in the day, pre-COVID, we'd probably been sitting in one of the Hearts Chamber luncheons and having presentations with various people and be sharing that space together. So remote working, virtual meetings, online sales, click and collect or home deliveries, diversification in your business. I saw a survey the other day that 25% of people said they're never ever going to use a cash point again. And I think that they think that the rise in online grocery shopping, that's grocery shopping, not clothing or what have you, is about 25%. Well, that's going to impact the high street without a shadow of doubt, and it may impact your business. There are lots of different things that you need to think about now that perhaps you didn't before, and assess your insurances accordingly. It may mean you tweak your insurance to get either better cover or better premium. Supply chain, again, hidden issues. Think of the supplier of the supplier. Maybe think closer to home and the risks associated with unknown suppliers. There is no doubt, and we saw this pre-COVID-19 pandemic, that more and more the end user is forcing insurance pressure on the supply chain. Know who your suppliers are, understand what implications are for you, and just don't make sure you're not the weakest link, because people will force that pressure down the line. And then the stuff we're all thinking about probably 24/7 really, healthcare, social distancing, PPE, cleaning stations. If you've got a retail shop, what's the implications of you putting cleaning stations there, either for your customers or your staff? And also a flip side to home working. I mean, whilst home working can reduce possible spread of infection, with no social interaction, that could lead to a lot of stress for a lot of your employees. So lots to think about. The global economy is expected to shrink by, I heard, 3% in 2020. Growth predictions for 2021 are 5.8%. That was a survey done by a leading firm of city accountants on various CEOs last week. So, and again, an insurer said to me recently, you need to make sure your customers are prepared for what that reduction in income would be, but also be prepared for the upturn and how your insurances are going to best deal with that. Just finally, that one thing that I think is worth mentioning and is very, very relevant, if you have a database, it doesn't necessarily mean say an exhaustive list of clients or prospects, it could be as simple as your staff, then you should have data and cyber liability insurance. Regretfully, in these sort of strange and uncertain times, we see an increase in the number of fraudulent claims, not just cyber, but you know, the first week of official lockdown, we saw a massive spike in attempted theft on premises. And also, I think April this year, we saw more alleged incidents of contractors and tradesmen's personal injury than we have done in the last 3 years. I've never known so many people fall off ladders. And you need to think about that. You need to think about the implications for your business. The National Cyber Security Centre, 5th of June, have indicated that they can actually track and trace over £5 million worth of fraud and theft that can be contributed to COVID-19 related cyber crimes. It's something like 2,204 crimes reported to action fraud since the 16th of March this year. And that's the only ones we know about. You know, how many have gone unreported or worse still have yet to be unknown, yet to be identified or remain unknown. Like all of us, I'm sure I can see a future remote working. I don't think I'd be too keen to commute via public transport to the city anytime soon. But what are the implications for you and your business? Can you guarantee the security and integrity of staff using their own computer equipment? Even if it's your equipment, how secure is their environment? And you know, how sure are you that they know how to police it? As I said earlier, there will be an increased pressure on supply chain, either to check or assume that you have suitable arrangements in place, not just to protect their income, but also their reputation, and that's far more important. So again, the message is don't be the weakest link. So just in summary, and again, that's just some headline notes and things that I'm hearing from insurers and what they're trying to talk to our customers about. Review and update your business continuity plan. Think about risk assessments in your changing environment. Conduct a business impact analysis survey, and think people, think premises, process and activities, machinery, equipment, supply chain, and IT. And just finally, your insurer should have some form of risk management tool that you can request or adopt or try and use. So don't be afraid to ask questions of them to help you through it. I hope that was useful. Thank you.
Thank you so much, Peter. Indeed, I think in both presentations today, we acknowledge there is an awful lot of content and fine detail that may need to be gone through in particular organizations and of scale of business. One of the questions that we've had from Gary Morley is, I think as a result of Kaajal's presentation, is the 50 employee returning to work need to publish risk assessment? Is that 50 employees in total, or is it 50 on top of those who have worked at the premises throughout? Because of course, some businesses have had employees at premises.
So my understanding is, thank you first of all, Gary, for the question. My understanding is that number of employees is with regards to the number of employees that the business employs as a whole. It's irrespective of how many employees have worked on the premises throughout the pandemic. And it is to do with a global number, and it's really as a result of consultation with various trade unions and business specialists, because what the whole premise is that they've set this number at 50, because then that is relative to how large the employer is, and then the infrastructure and the needs that, you know, the degree of risk that needs to be assessed as a result. So it's not to do with how many people have worked during the pandemic, how many people are coming back, or how many people are likely to come back. It's to do with how many employees you have as a whole.
Thank you for that. Thank you for that very much. And also thank you for your excellent presentations, both of them. Very informative, very interesting.
Thank you.
So I'd like to open up to the floor if there are any other additional questions. By all means, please feel free to unmute yourselves and perhaps put a hand in the air or use the images in reactions at the bottom of the screen. Or equally, if you're an organization that either employs more than 50, you've already gone through the risk assessment process or the updating of the risk assessment process, if there's anything you'd like to share with this group, it would be really useful. looks like everybody's ready to get back to work. I'm not sure. I think it's a bit of a minefield, but I don't know if there are any other closing notes. If we don't have any questions, we've mentioned at the beginning that we'll certainly share slides. I think there is a lot to digest, and I would really encourage you, if you've got specific questions, not now because you are taking all of the information on board, to reach out very personally to Kaajal and to Peter or with those particular questions. Are there any perhaps summary notes, or if you had the top 3 takeaways, Kaajal and Peter, that you could just share with everybody, because there's a lot of information that's been gone through today?
I would just say top 3 takeaways are, do what you've been doing all along. Don't be frightened. It's really difficult because you see all this raft of guidelines and you think, oh my God, it's a whole new thing that I have to do. It's a little bit of a new thing that you have to do. All organisations have been undertaking risk assessments to, avoid risk of employees tripping over trailing computer wires, etc. As I mentioned, this is just an enhancement of that, so it's a little bit of extra work, so don't be frightened by that. The second takeaway is I would just say maintain an open dialogue with your staff with anything relating to COVID at all, because it's really important for you to know your staff and their individual circumstances. You never know when a red herring might present itself, and that will completely change how you will approach the situation in your workplace and health and safety with regards to that specific individual. So that's a sort of twofold takeaway.
Brilliant, thank you.
And I'd reinforce that again. It's a common sense approach. It's not I don't think anyone's expecting anyone to sort of write reams and reams and reams of risk assessments, and it's a common sense approach into protecting your workplace and your environment. From an insurance point of view, if you haven't already done it, think data and cyber liability, because that is going to have a massive impact moving forward.
Indeed, and you've reminded me, Peter, that we hear the expression data is the new oil or the new gold. It's replaced that in terms of its importance, so we have to protect those assets. Last chance for any other questions. We are coming up. Oh yes, thank you, Spencer.
Hi, it's not really so much a question, it's more an observation, and just a quick disclosure. I'm one of Kaajal's colleagues. I'm a commercial lawyer at Curwens, but I think some of the feedback that I see from clients, there's a lot of sometimes I guess stress and people feeling vulnerable. How much resource do you put to this? How much money do you put to invest in getting things to where they ought to be? And it comes down to, I think, standards. And certainly, I think another challenge is just maintaining the standards where they need to be, because actually there isn't an excuse for sort of cutting corners, and that's just a general challenge when you're in a squeeze.
Thank you very much indeed. I also would add to that in saying, as a chamber community, you have a wealth of expertise in and amongst chamber members. So please consider during this period of COVID and after we're coming into the new normal to reach out, to have dialogues, discussions, and so on. And I'm reminded on this call today, there are a number of businesses that have reached out to the chamber for introductions to others who may be able to help them answer some of those quandaries and give them peace of mind. And that's absolutely what we're here to help to do. So I'm quite pleased that we've come to 11:41. We're scheduled to finish at 11:45. Please continue to connect with one another beyond this webinar today. Thank you for your participation. We hope we will see you at the next one. We have regular networking, general networking every other week on a Wednesday. Have a look at heartschamber.com if you've not participated before. For those of you who are chamber members, thank you. Welcome back. It's wonderful to see you. And equally to those of you, it may be your first webinar with Hearts Chamber and you'd like to find out a little bit more about how we can support you during this period of time and beyond, we'd love to hear from you. So thank you so much. Have a safe, good rest of your day, and we will see you again very soon. Thank you very much.